Hello, this is Dr. Sohan, oral and maxillofacial surgeon at Eledent Hospital, Banjara Hills. Today we are going to discuss about the topic oral submucous fibrosis. So this oral submucous fibrosis is predominantly seen in the South Asian population, and in India 0.5 population are affected with the oral submucous fibrosis. It is usually seen between 20 to 40 years of age. And 5% females are affected with this oral submucous fibrosis, whereas in males it is 2% are affected. And what are the reasons for the oral submucous fibrosis? This oral submucous fibrosis is usually seen in the patients affected by having a habit of aracanut chewing, having spicy foods. Like in aracanut chewing, usually having the habit of zarda, khaini, tambaku, gutka, and how much time they place it in the mouth and in the which region they place it and how many packets they eat per day, and how much time they keep it within the mouth matters, and the severity also depends upon the how many packets they use per day. In young patients, after the onset of 3.5 years, usually oral submucous fibrosis is seen, and whereas in older patients, it usually starts around after onset of having the habit of around 6.5 years. And what are the carcinogens present within this aracanut chewing and also having the spicy foods? In spicy foods, they have a carcinogen component called as capsaicin. This aggravates the burning sensation within the mouth. And whereas aracanut chewing has carcinogens such as alkaloids, flavonoids, and copper. These alkaloids produces collagen, whereas flavonoids inhibits collagenase, and whereas copper, which causes cross-linking and stabilization of the collagen production. So when there is increased in collagen production, then the oral mucosa becomes stiff. When there is stiffness within the oral mucosa, there is reduction in the mouth opening, and these things, carcinogens, can also cause burning sensation within the mouth. And on having these habits, aracanut chewing and spicy food, excessive spicy foods, what are the changes it is you can see in the initial stages and in the later stages? I'm going to explain you. In the initial stages, patient complains of burning sensation within the mouth, and there will be excessive salivation within the mouth, and also there will be vesicles and papules. And whereas in the later stages, you can see bands will be palpable. There are some bands which are palpable within the mouth and which causes reduction in the mouth opening. And there is also hyposalivation. There is decrease in the saliva production, and there will be difficulty in chewing and swallowing due to decrease in the mouth opening and formation of excessive bands within the mouth in the oral mucosa. And there is also difficulty in tongue protrusion, because in the later stages tongue protrusion can also become difficult because the mouth opening depends are into various stages. It might be grade 1 stage, grade 2 stage, grade 3 stage, grade 4 stage. As the mouth opening decreases, there will be increase in the stages of your grade of the OSMF. Your grade increases as there is decrease in the mouth opening. Why there is decrease in the mouth opening? As I said you, in the later stages there is excessive production of collagen, and whereas the collagenase is the enzyme which breaks down the collagen. So there is also inhibition of the enzyme collagen, and there is also copper present within those carcinogen, aracanut chewing, and which causes stabilization of this collagen, and there is automatically reduction in the mouth opening. And there is stiffness within the oral mucosa. Your oral mucosa becomes very stiff and becomes pale. You have excessive burning sensation, which more uncomfortable to the patient. And how you are going to encounter and what is the management for this oral submucous fibrosis? First of all, it should be with the stoppage of the habit. That is, complete cessation of the habit is required. for the good results. First of all, there should be cessation of complete cessation of the habit. Secondly, there can be non-surgical management, and there will be also surgical management. Initial stages in initial stage, the OSMF can be treated with the non-surgical management, and in the later stages where the mouth opening is very less, and if it is in the grade 4 stage and mouth opening is below 15 mm, in such cases there are high chances of surgical management. So I'm going to explain what is non-surgical and surgical management. In non-surgical management, usually through medical management, that is, firstly we give medications, later we give some injections, then we do some physical exercise, physical therapy, that is showing some physical exercise which can be done. So through these medications, injections, and through physical exercise, we can increase your mouth opening. And if after, even after the medication, non-surgical management, still the mouth opening is not increased, then we go into surgical management. In surgical management, we remove the bands in the oral mucosa. These bands removal depends upon the grading and staging of the oral submucous fibrosis, and what is the how it rehabilitation is done. We do some flap surgery may be required, and that depends upon the severity of the oral submucous fibrosis. So for more information on oral submucous fibrosis, please visit Eledent Hospital. Thank you.